Hi, this is Dr. Amanda from StraightSmile Solutions. You are about to enjoy a video that is the property of AlignFlow Orthodontic Company. AlignFlow is an app that patients can use to communicate with their doctor during orthodontic treatment by sending HIPAA-compliant photos from home to their doctor. This video has been posted on our YouTube site with the permission of the AlignFlow team. If you'd like to learn more about the AlignFlow team, please visit www.alignflow.com. Although the app is the property of AlignFlow, many comments made during this video are those of Dr. Amanda Wilson and StraightSmile Solutions. StraightSmile Solutions is an orthodontic consultancy company that supports general and pediatric dentists to do more orthodontics in their practice. To learn more about StraightSmile Solutions, please visit www.straightsmilesolutions.com. Enjoy the show.
Question is the greatest takeaway, and you talked about this a little bit, the greatest takeaway for getting started with aligners for teens versus adults.
Sure. I think this is something that a lot of doctors, even orthodontists, don't do great at. So I like to get to know my teens, and for the most part, most teens, and even initially take the parent out of the equation, because sometimes parents are just fully thinking about cost, right? And they come in with a predisposed notion that aligners are going to be more expensive than braces, or they're not going to work as well as braces. And 20 years ago, yeah, I mean, they were more expensive and they didn't work as well. But guess what? They do now, especially if you're in trained hands. And there really is no case that I can't take. And most orthodontists will pretty much say this as well, with a few exceptions. And exceptions are going to be obviously surgical cases, impacted canines, and a few other things. But for the most part, there's no case that I can't do faster with Invisalign. I'm saying Invisalign, I'm not saying ClearCorrect, because it has a lot more tools and widgets that I can use. Sometimes I have to incorporate a few tricks and tips from braces in order to get there, but I am very confident that I can make a case just as good, if not, and as fast, if not faster, in Invisalign. Again, few exceptions. But as far as, so that takes that, you know, in terms of efficiency and outcome out of the equation. You just have to be confident about that. I mean, obviously, if you're not confident, you need to get your confidence up and learn to do it better. You know, it's a tool. You have to learn how to use it. But as far as compliance, so many parents think that a teen's not going to be compliant. And that is, from my experience, that is super not true. First thing I like to do is I like to talk to the teen, you know, take the parent out of the equation and say, hey, you know, if you were able, if price wasn't an option, you know, and you got to choose, you're going to get the same outcome, same amount of time, would you prefer to have clear aligners or braces? 990 times out of 1,000 patients, the teen will say they want clear aligners, like hands down. What's interesting is, you know, it tends to be a little bit more bicoastal, but where I live, I would say more than 50% of my kids are teenagers, and 50% of their classmates have Invisalign or some type of clear aligners. It's pretty normal now. If not, it's more normal than braces. Maybe less so in flyover country. Maybe Dr. Keith's not seeing that with teenagers where he lives. I think things take time to get used to, but also our doctors where I live, they're charging the same price and they're very confident, you know? And in terms of patient experience, I had braces as a twice, and then I had aligners. So I've had it all, you know, I've had kids that have had multiple different things. But the experience in terms of just the patient experience is so much better with aligners. Braces were so uncomfortable. And I remember as a teen, you know, being 16 or 17 and getting my braces tightened and just crying for days and having to eat pudding and yogurt for days. And that was the only option we had back in the 80s, right? But now we have other options. Why put your teen through incredible discomfort and actually more risk? Because it's rougher. I've never seen a root resorption case on an Invisalign patient. I've never seen one. And I don't think Invisalign has either. But I've seen the rate is a good 5 to 10%, you know, with braces patients. I mean, severe damage can be done to braces patients when they go on too long or using too heavy of forces. Sometimes it just happens. It is actually healthier in terms of hygiene, decalcifications, not to mention the general breakage, the amount of appointments to have aligners over braces. So anyways, I say just be confident about the experience and make sure your patients are comparing apples to apples and not apples to oranges.
Dr. Keith, is there anything you want to share from your practice about the teens versus adults in aligners, or anything, you know, speaking to the trends that Dr. Wilson mentioned?
You know, I think that your teens are honestly, sometimes they're more upfront with you about if they're going to wear them or not than the adults. And if you've got a kid that's all about wanting their teeth straight, they're going to wear their aligners. And you know, that a lot of times that's the concern is this teenager going to wear their aligners? Now, if you have that kid that they don't want to do it and mom's the one that wants their teeth straight, maybe not your best case. But I think that for those people that the 16-year-old that comes in and says, I want straight teeth and I don't want braces and I want this, man, that's a slam dunk, rock and roll it.
Slam dunk. Yeah. And you can also look into like, I like to interview the patient, tell me what you do outside school. Tell me about your grades, if they're, okay, I won't say, I'll give the positive thing, but if they're in orchestra or they're in a sport, obviously they're a disciplined individual. If they have good grades, there's very few teens and they walk in, their heads hanging down, they're going like this, they're not happy to be there. Well, the mom looks frustrated. That's not going to be a good patient for you no matter what. They don't want it. And if they don't want it, they're not going to be compliant no matter they have braces or aligners. They're going to break the braces off. They're not going to wear their elastics. They're going to get decalcification. They're going to get decay. So just don't treat them.